So part two is all about competition theory, and it's really important to understand competition because we've seen a revolution in the way in which public services like gas and utilities are provided over the last 30 and 40 years. So the first concept is that around perfect competition. Now this is a theoretical framework where competition is it's such a highly competitive perfect market that actually profits are eliminated. Now the process for this is you have a market, there's freedom of entry and there's profits. So competitors come in because they want to make a profit. They're seeing big money being made. That also then drives up the quality because you've got more people in your market. But then what happens is actually over time, the more competitors come in, the less profitable it is to be in that market. And eventually what happens is so many people are in that market competing, the profits fall to what we call supernormal profits are removed. So there is no abnormal profits being made. And this is a key thing about competition and why government has gone so much for it is this idea that actually privatisation doesn't maximise profits. In theory, it should minimise them. So the practical example I'll give you is you are tired, you've just left work, you want to go home, you're in the supermarket, they've got some bananas, it's 3 for £2. That's quite a lot of money for some bananas, but you're going to buy them anyway because there's no other option. Put yourself into a massive fruit market where there's 300 sellers selling bananas, you're going to get them for 50p. That's how perfect competition works. Imperfect competition is generally what we have in real life, and this is where a lot of public service provision can go quite wrong. Now, one of the worst kinds of imperfect competition is oligopoly. That's where you have a small number of providers who sort of operate together and raise prices by sort of not so much conspiring to raise them because that would make them a cartel, but also just observing other people's pricing behaviour, keeping out other competitive agents and therefore maintaining abnormal or supernormal profits. So a great example of this is local authorities. They'll have 3 preferred providers that they will be doing all their maintenance. Those preferred providers know that there's probably a pretty good price that the others will charge, and so they have no incentive to actually keep those prices low. And the second type of imperfect market is profiteering. Now this is really crucial when it comes to the National Health Service. So profiteering is where someone is willing to pay vastly over the costs of production. And a great example of that is, God forbid, your child is sick, needs a new kidney, the cost is about £20,000. You would willingly pay £200,000 for that operation to ensure that your child is healthy because it's your child. And because of that, there is this ability for providers to effectively profiteer, to say, well, okay, it might cost us this, but we're actually going to charge you that. And this is where the NHS has a vital function as a public service because it eliminates that through collective risk sharing and being paid for by taxation. So those are the 2 main markets. The big message I have is that, look, competition can be bad when it's imperfect, but actually it's amazing when it isn't. And if you can just get to a point where you've got enough competitors working together to drive up quality, trying to get those profits down and avoiding an oligopoly situation, then you're on to a winner.